We're in a small rural school in Maine. We have around 110 students, so we lack a lot of resources. It's hard to find counseling services and mental health services for our students. So the telehealth piece was something we were looking into. We have a lot of training about the importance of mental health services and getting those for our kids, but we just lacked the ability to do that in the school. We're working with St. Croix Regional Family Health Center, and so I trusted them. They were reputable and that they work hard to provide our community with what they need, but I did not know how our two organizations could work together. There were some issues with like paperwork and what they require versus what we would need. So those pieces were things we had to work together and talk about. Also, I didn't know how our students would deal with online services. It's actually gone really well, but at the beginning it was how would we provide that to our students and how would they respond to it. I think just being flexible was really important, and having lots of communication was really important, and being open to what they need versus what we need, and trying to find a common ground for what our kids need. Finding a space for the worker was a challenge. I ended up putting her in a small ticket booth, and that was in the it's in a central location in the school. It's actually been a great spot because she's in the heart of the school. The kids see her when they walk down the hallway, so she's created great relationships with all the students and the staff. She attends all of our staff meetings and all of the trainings that involve mental health and students' mental health. The person that you hire does matter, so getting somebody that really has that ability to connect with others and reach out to others and be flexible is really important. So every Thursday we meet to talk about our students who are receiving counseling, if there's anybody else we think needs to be added, if there's any families that need support in other ways in the community. She is a part of that group that meets and has those conversations. Our kids trust our navigator. They see her every day in the hallway. She goes to recess duty and lunch duty because she wanted to form those relationships with kids. She's organized. Organization is really important, and flexibility, being able to be flexible with parents and students and administrators. We currently have a therapist that's very engaging and easy for kids to connect with and communicate with. So we've seen an increase. Now we only have telehealth, and we've actually seen an increase in our students receiving those services. And I think that's because of the person that we have working with them and the openness of families to telehealth now. There hasn't been a difference between the two, in-person versus telehealth. It matters about the person that's hired to work with kids. We still need a private room for the student. We still need to schedule the services. We're still working with a counselor. So logistically, it's the same lift on the school and on our navigator. I meet with kids a lot in the office. They come to see me often. And so I've been able to have conversations with kids about what's going on in their lives, and also if the counseling is helping them. And a lot of the strategies that they're learning in counseling, they're actually putting into use in their classrooms or able to talk about in the office when they come see me. We are seeing an uptick in testing scores. Also, we really focus on social emotional learning, and if kids are applying those skills that they're learning in counseling to their everyday life in school. We do use a behavior slip system still, so we've been able to track that data as well. Our counselor's been really great, and she meets with parents directly and with the students a lot. And so with the parents on board with counseling and that time with the counselor, that's also helped really connect those pieces that are so important. The program's running better than I had expected, but I think since COVID and since everything went online, we've seen less of a stigma around telehealth, and we've also seen more people recognizing that getting help isn't unusual or something that we should be scared of. It's something that we should embrace. So a lot of our families have changed their perspective on that and have been willing to accept this help, which is great.